I'm Robert McMullen. I'm a psychiatrist, and I'm going to talk about how to get out of depression using TMS, transcranial magnetic stimulation. A little background. I went to Georgetown Medical School, and then I did my residency at Columbia Presbyterian Hospital. And then most of my life I've specialized in using medication to treat difficult psychiatric illnesses, and especially treatment-resistant depression, both in unipolar patients and in bipolar patients. These types of depression are, by definition, very difficult to treat and to bring people all the way to euthymia. And often we need 4, 5, or 6 medications to really improve somebody, and sometimes they are still not at 100%. Maybe they're at 80% or 90%. So when TMS came out, I obtained a machine in 2010 and was very surprised to find that at least half of the patients that I treated came all the way to a normal mood in 30 treatments, even though they had never been in a normal mood in their life. That's really shocking, because after they've failed on 5 or 10 different medicines over many years, what's the odds that the next medicine is going to bring them to a completely normal mood? Perhaps if you used an MAO inhibitor, it would work better than the previous medications, but the odds of it bringing them all the way to normal is very low, less than 2%. So this was quite surprising. And a second surprise was that I wrote up 5 patients who were a little bit more difficult than usual to get out of their depression, like they took 40 or 50 treatments spread out over time before they really stayed in a normal mood. I wrote these patients up about a year after their treatment. All 5 of these people did not relapse till over 3 years later. And one of them has gone over 4 years without a relapse. And then when they relapse, they just need 5 or 6 treatments usually, and they're back to normal. It's important when you get TMS to be still on your medication, especially if the medication is working. So we do much better in private practice treatment of depression than the studies that are done in the hospitals have done. And it seems to be primarily because we leave them on their medication. And in the studies, they often took them off of all their medication, so then the patient's really at the bottom. You could even look upon TMS as an augmentation, that it's really augmenting the antidepressant effect, because you add this on to the standard treatment and bring them all the way to normal, and then they stay on the medication after the treatment. What's different about it is this augmentation often works 100%. That all the other augmentation things you've tried, a little lithium, a little thyroid, a little Abilify, and so on, did not bring them all the way to normal, and then this often does. And it stays, that frequently the patient will go, as I said, many months or a few years without relapse. Now, a few of our people relapse every few months, and then they come in and get a treatment or 2 or 3 treatments, and so unfortunately they have to have several treatments a year, but it's still better than what they were suffering with before. It's really a revolution in psychiatry, and it's rather surprising that more people don't know about it. I think there's a number of reasons. I think psychiatrists don't think of using technical machinery to treat people, and it sounds weird to use a big magnet on the head, and it's a little difficult to convince people to do some new radical treatment that they've never heard of before, and which takes up time. You have to do maybe 20 or 30 treatments. If you want more information, feel free to call me at 212-362-9635, 212-362-9635, or look at our website.